Mushrooms are popping up in pet supplements everywhere, but is there any evidence that they actually help cats with chronic kidney disease? Let's unpack the theory, the gaps, and what you need to know. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. I've been in this profession long enough to realize that there are cycles to it. There is constantly a new product being touted as a cure-all for everything. Coconut oil is one example. It was good for everything. You should eat it. You should drink it. You should put it on your skin. Another one is essential oils. Apparently they can cure everything. CBD fits into that category where it can fix everything. And while some of these things have benefits, they're definitely not a cure-all. And I promise you, if I find that magic fountain of youth, I will let you all know. But until then, we have to be very cautious when new products or new claims are brought to market. Right now, it seems like mushrooms are that latest and greatest thing. For example, a type of mushroom called cordyceps is marketed for everything from an increase in energy to kidney support. When any product comes to market with a big, broad claim like that, it should really make you pretty skeptical. Now, does that mean mushrooms don't have a benefit? No, not at all. But you need to be skeptical. Anytime I'm looking at something that I'm going to be giving to my chronic kidney disease cat, I want to look at what is my goal in giving this product? Is there any evidence in giving this product? Is it safe? Is it processed by the kidneys? Will my cat even take it? And are there safe, effective, studied products already on the market? So when we're looking at supplements for the kidneys, we're generally looking for something that's going to decrease inflammation, decrease fibrosis, or decrease oxidative stress. Those are the three main factors that I don't want to say we struggle controlling, but those are big players in making kidney disease progress. So those are the things that we tend to focus on to see, can we stop them? Can we reverse them? What can we do to impact these three major players so at the very least we can maybe stop the progression of kidney disease? Where do mushrooms fall into this? Well, in theory, at least the mushrooms that are considered safe for cats, they have anti-inflammatory properties. So by bringing mushrooms to market, the theory is that the creator is trying to target the anti-inflammatory benefits of these mushrooms in the kidneys. Now, we do know that cordyceps has demonstrated anti-inflammatory properties. It has decreased protein loss in the urine, and in some cases has even increased the filtration rate of the kidneys in mice, rats, rabbits, and humans. Unfortunately, not cats. There is not a single study that has been done in cats, at least no published high-quality studies that have been done in cats. And unfortunately, it's not uncommon that cats get the short end of the stick. There's a lot of things that we don't have studies specifically in cats for, and yet we use them in cats. But we do have to be very careful with that mentality because obviously, cats are not humans. And just to give a really simple example, humans take acetaminophen for anti-inflammatory benefits. Yes, there is a toxic dose, but in general, we can take a standard dose and it's safe and it's fine and we get those benefits. Tylenol or acetaminophen will kill a cat. They cannot metabolize it appropriately. So you can't assume something that is anti-inflammatory in a human is going to be anti-inflammatory in a cat and be safe. This is where the studies come in. This proves the theory. That being said, why are some veterinarians cautiously optimistic about this modality? Well, it's because the mechanisms of action make sense in chronic kidney disease. Again, though, we have to be careful with that line of thinking. And the perfect example I can give you is that we know vitamin E is an antioxidant. If we go back earlier in the video, I mentioned one of the things that we want to address when we're trying to stop or slow the progression of chronic kidney disease is oxidative stress. Oxidative stress is addressed by antioxidants. Vitamin E is an antioxidant. We know this, we love it. It's got its own thing going on. But a study was done using vitamin E, a known antioxidant, in chronic kidney disease cats to see if it would affect survival time or if it would affect any clinical signs. And guess what? It didn't. Not a thing. Vitamin E did not affect the survival time in cats, even though we know it's an antioxidant, and it didn't decrease the expression of clinical signs. So we also have to be careful when we think we know it makes sense. This is why we do studies. So even though the mechanism of action of some mushrooms in chronic kidney disease may make sense, it doesn't equal a cure. We also know that mushrooms aren't necessarily harmless. Some mushrooms increase the risk of bleeding. They interact with other drugs. They can affect blood pressure. And of course, anything you take orally or you give your cat orally can cause vomiting or diarrhea. So it's also important to not assume that anything plant-based, a supplement, an herb, anything that's not a drug, you can't assume it's automatically safe. Now, that being said, do I think you should totally ignore mushrooms? No, I think we need a lot more proof and a lot more studies to tell us what we're doing with them. And there are some really exciting things that may happen in the future. But I don't think it should be your go-to therapy for anything chronic kidney disease related, at least not yet. Going back to what is my goal? Well, if we were to use mushrooms, the goal would hopefully be an anti-inflammatory, an antioxidant, or an anti-fibrosis effect. Is there evidence for it? None. Not a single great study in cats has been done for mushrooms. And is it safe? Well, the jury's out. Some may be safe, some absolutely aren't safe. And are we giving the kidneys one more thing to deal with? Remember, we're dealing with an organ that's failing here. It's not a normal functioning organ. We are trying to keep it functioning, but it's failing. So any extra work that we give it to do potentially puts extra stress on it. So we want to keep that top of mind. And are there other options? There absolutely are. Could we improve our management of chronic kidney disease in cats? I'm certain we can. We always can. That's why there's ongoing studies. But we do have approved and studied medications in cats to help with protein loss in the urine. We do have supplements that decrease inflammation and again have been studied in cats. And the jury's still out on increase in filtration, but we have ways kind of around that at this point. So do I think mushrooms should be your first choice to grab and go running in and try and manage your cat's chronic kidney disease? No, I don't. And I don't know that it ever will be. Even in humans where we have some of the studies done, it's usually an adjunct treatment or an add-on treatment. And if you're interested in it, I would certainly encourage you to talk to your veterinarian about it. If they don't have knowledge of integrative concepts, then they can reach out to some colleagues who are either more knowledgeable in the use of mushrooms or have been using them. And if you do make the decision to add them to your cat's management strategy, you want to monitor very carefully. Anytime we add something in that we're not 100% certain what we're going to get on the other end for effects, we want to measure our blood values. We want to make sure we watch what our cat is doing and responding. We also want to keep the placebo effect in mind because, as I've said before, humans are outstanding at the placebo effect. It is amazing how many times we think because we change something and something happens with our cat, correlation does not equal causation. In other words, without all of the factors being the same, just because we think we see or know something doesn't mean that's always the case. So monitoring becomes a big deal. You also want to make sure you have a quality product. And this applies to any supplements. We learned this with CBD products in that there's a lot of heavy metal toxicity with them. So we want to make sure we're looking at quality products if you're going to use them. And if we can prioritize evidence in our management and treatment strategies, that's ideal. If we have done all the evidence-based things and we're still not getting the results we want and we need something else, this may be a secondary option. When it comes to medicine, promising does not mean proven, but asking thoughtful questions, that's always a good start. If you found this video helpful, let me know in the comments below. I'm always looking for suggestions on video topics to answer your questions. And of course, subscribe and like the channel so that I can keep doing this for you.